Hi friends, we know diffuse large B-cell lymphoma can be very nasty. We know that good risk DLBCL, which is defined on loosely on a cell of origin, either ABC or GCB, but depending on that, you can have a different responses to chemotherapy, frontline chemotherapy. And we also know that genomic classifications are very fast coming into the picture, where we have a double hit lymphoma, triple hit lymphoma, and they do very poorly with the frontline chemotherapy. And that is why beyond R-CHOP is still giving a good fight to DAE-POC-R or POLA-R-CHP in these subsets of patient. Great. 60% people will be cured with the frontline therapy. What happens to the 40% people? Diffuse large B-cell lymphoma can present you with anything. Again, fever, weight loss, night sweats, lymph nodes, enlargement, abdominal swelling, persistent fevers for more than 3 to 4 weeks. That is where the rule comes in. So you diagnose it, give a R-CHOP. If you're doing well, you do not do anything. Monitor with them ctDNA or a PET scan. If you relapse, that's where the second line therapy starts coming into play. And where does the second line therapy comes in? If you relapse within 12 months of a frontline therapy, CAR T-cell is the right choice. And that's what the government of India has given approval right now. In a relapsed patient who has relapsed within 12 months of chemotherapy, frontline chemotherapy, you are eligible for CAR T-cell. People who are refractory, there will be 10 to 15% people who will be refractory to the frontline therapy. They will just not respond. That's where you can use CAR T-cell. And fortunately, unlike B-cell ALL, in DLBCL, CAR T-cell is considered as curative. So you are giving a CAR T-cell with an intention of curing the subsets. What remains investigational? People who are elderly, you cannot get a bone marrow transplant done as a frontline therapy. Double hit lymphomas, again a frontline therapy. Triple hit lymphomas, again a frontline therapy. But we have to wait for Zuma trials to come and show that in a randomized fashion that these can be moved on to frontline. In past 5 years, we have moved on from fourth line to second line, and in the coming days, by 2027-28, we will come to know whether these powerful therapies actually move on to the front line or not. So in DLBCL, remember the CAR T-cell is approved in patients who are relapsed refractory or who are relapsed within 12 months of their frontline therapy. Thank you.